Welcome to This Explainer. As medical educators at Westminster Multispecialty Clinic, right here in Dubai Healthcare City, we're going to walk you through exactly why, right now, as the temperatures really start to spike, is actually the absolutely perfect time to address that lingering injury. We're going to dive into the structural reality of the summer season and the clinical reality of your own anatomy. The goal? To show you how a strategic approach to recovery can get you right back to your absolute best.
Okay, let's jump right in and address the elephant in the room. We're talking about that injury just kind of living in the background. You know exactly the one I mean, right? It doesn't quite stop you from doing things, but man, it's there. You notice it every single morning getting out of bed, or maybe every time you toggle the stairs. It's that clicking knee or that pulling shoulder that literally makes you pause and think twice before booking a weekend paddle session. Or maybe it's that hip that's felt just a little bit off since a long run you did way back in March. We totally normalize these sensations, but why do we actually do that?
Well, at Westminster Multispecialty Clinic, what we see with patients constantly is this exact mindset. Honestly, we all carry these injuries around for months, and the reasoning is almost always the same. You tell yourself, it's not the right time, or you're just way too busy with work and social stuff, or, and this is the most dangerous one, you convince yourself that it's just going to magically sort itself out. We use these exact same excuses, but the reality is waiting actually works directly against your anatomy. The human body is incredible, no doubt about it, but it just doesn't always heal correctly without a little bit of expert guidance.
But then, summer arrives in Dubai. From June onward, that intense outdoor routine that defines so much of our lives here, it hits pause. As the evening runs along Jumeirah Beach Road stop, and the Al Qudra cycling groups kind of thin out in the heat, the whole city quietly shifts gears. Paddle bookings drop, we all head indoors. And what this does is create a highly practical window of opportunity. Suddenly, clinic availability is way better, scheduling your follow-ups is a breeze, and your own calendar is far less fragmented by trips or school runs. Basically, you finally have the mental space to tackle the things you've been putting off.
Now, there's a very specific clinical reason why you shouldn't just wait until winter to see how you feel. The absolutely crucial point here is that orthopedic injuries, they rarely just resolve on their own. Some might feel like they settle down, but what's actually happening under the hood is adaptation. Your body compensates by loading other structures differently. Think about it, a sore knee completely changes how you walk. That altered gait then puts uneven weight on your hip. And eventually, the hip starts screaming at you too. So months later, you don't just have one straightforward problem anymore. You've got two, and neither is simple to fix. Let's look at the hard clinical cost of waiting, because our tissues don't just magically regenerate. When you leave a partial muscle tear untreated, it can turn into scar-laden tissue, which ruins your flexibility and vastly bumps up your chances of getting hurt again. With ligaments, an incomplete recovery leaves the whole joint unstable, which just compounds the stress over time. Tendons are incredibly tricky because they have poor blood supply compared to muscles. Without intervention, they can actually calcify, stiffen up, and turn into a chronic nightmare needing months of rehab. And cartilage, it simply doesn't regenerate like soft tissue does. Getting an assessment early on means you have options, like using platelet-rich plasma or PRP injections to slow down deterioration. That's a game changer that just isn't possible once the damage is too advanced. Now, our team's approach to this is entirely rooted in reality. We know full well that people avoid seeing us because they absolutely dread the word surgery. There's this massive misconception that stepping foot inside an orthopedic clinic means you're automatically going under the knife. But guess what? The vast majority of our consultations do not end that way. They end with a proper diagnosis, a solid conservative management plan, and a super clear picture of what to monitor. Surgery is really just one tool in the toolbox, and our experienced specialists only recommend it when every other approach has been totally exhausted or when your anatomy genuinely demands it. So let's totally demystify the process. Here's exactly what a first visit at Westminster Multispecialty Clinic looks like. Step 1, a really thorough clinical examination. Step 2, a deep dive into your specific history. How and when did the pain actually start? Step 3 might involve imaging, like an X-ray or MRI, but only if we truly need it to see what's happening inside the joint. And finally, Step 4, building your customized plan. For most folks, that means physiotherapy, load management, maybe some injection therapy, or honestly, just a structured period of modifying your activities. Our ultimate aim is always information, not alarm. We want to build a safe, structured pathway forward for you. But hey, sometimes surgery is genuinely required when an injury is really severe or when all those conservative approaches we just talked about have been fully exhausted, it becomes the necessary next step. And if that's the case, mapping your restricted range of motion and your supervised rehab onto the absolute hottest months of the year makes incredible practical sense.
I mean, why be sidelined during the beautiful winter months when you could be doing the hard work of recovering right now while everyone else is hiding indoors anyway?
To put that into perspective, let's look at the timeline for something like an ACL reconstruction, a shoulder rotator cuff repair, or even a hip replacement. Say you have the procedure in July. You spend that sweltering month just resting and doing protected weight bearing. August, that's dedicated to intense physiotherapy. By September, you're starting a graduated return to your activities. And by October or November, you're fully cleared for sport right when the Dubai weather gets gorgeous again. It's completely strategic. Patients who plan their recovery this way tell us all the time that the whole process felt far less disruptive than they ever thought it would.
And beyond the physical healing, there is a massive psychological component to all of this. Patients who finally come into the clinic after dragging an injury around for 6 months almost always tell us the exact same thing. They wish they had come in way sooner. And that's not necessarily because the treatment was a walk in the park, but because giving that constant background ache an actual name provides huge psychological relief. Taking a vague, nagging discomfort and turning it into a diagnosed condition with a clearer, actionable treatment pathway, that fundamentally changes how you feel about your body and what you're willing to do to fix it.
Because listen, summer in Dubai will eventually pass. The weather is going to cool down, those paddle courts will become impossible to book again, and the running groups will be back in full force at Safa Park. So as we wrap up this explainer, we want to leave you with this one question to really chew on. When this season changes, will you be fully fit and ready to join them? Or are you going to carry that exact same background injury into a whole new year? Reaching out to our team at Westminster Multispecialty Clinic for a quick initial chat costs absolutely nothing, and it is a significantly better strategy than just sitting back and crossing your fingers that things magically get better. Thanks so much for joining us for this explainer, and hey, here's to a smart, strategic summer recovery.